Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, Lymphoedema Physiotherapist and ESSA accredited exercise physiologist. In this episode I'm going to be answering a really simple question, but a question that's really important to a lot of patients who've been diagnosed with breast cancer, and that is, am I still at risk of lymphedema if I've only had a sentinel node biopsy? So first of all, let's just clarify what is a sentinel node biopsy. Sentinel node biopsy is when you've had one node removed. The sentinel node is the first node that the breast drains to, and this is the node that the breast surgeons usually will be checking out to assess whether it has cancer in it. Now, if the sentinel node is assessed and they find there is no cancer in it, then usually it means they can leave the other nodes in place and not do what they need to do, which is when, if they do find cancer in the sentinel node, they then usually go on to do an axillary lymph node clearance, otherwise known as an axillary lymph node dissection, which is essentially where they remove any suspicious looking nodes that they think may have cancer. Following that procedure, they then have to further go on and test the removed nodes to see if the ones they have taken out have got cancer in them. So that's what a sentinel node biopsy actually means. Now, before we answer the question, if you enjoy this content and you would like to see more, then please subscribe to my channel, which is completely free. Give this video a big thumbs up and leave a comment in the section below if you have any questions on this video or any other topics around breast cancer. So let's answer this question. Am I still at risk of lymphedema if I've had only a sentinel node biopsy? The short answer is yes. Now, statistically, it is shown in the research that the higher the number of lymph nodes you've had removed, the increased risk you have of getting lymphedema. So what that doesn't mean is that if you've only had a sentinel node biopsy performed, that you are not at risk of lymphedema. Yes, your risk is lower, but you are still at risk. And this is what I want to point out in this video, guys, is that clinically, I still see patients that have only had one lymph node removed getting lymphedema. Now, it doesn't happen every day of the week, but it certainly does happen, and it probably happens a little bit more often than you think. Now, the reason I want to mention the statistical research and the clinical experience that I've had is that they don't always match up, and this is where it can get frustrating, because as a lymphedema physiotherapist, I'm the person that is seeing the lymphedema, treating the lymphedema, diagnosing it most of the time. Whereas when people are going through breast cancer treatment and they're talking to other members of their medical team, other members of the medical team who are not lymphedema experts may be a little bit more reliant, understandably, on statistical information around lymphedema, which is where they won't necessarily push the point and get patients who've only had a sentinel node biopsy down to a lymphedema therapist for lymphedema education, LDEX score testing, and so on and so forth, because they've been sort of placed in the category of, oh, well, this patient's only had a sentinel node, so they're probably not going to get lymphedema, so they won't push the patient to go and do that. Whereas if there is any medical professionals watching this video and they have seen this is a little bit of a theme coming through, where they tend to not refer their patients on for lymphedema education and preventative testing, then I would implore you to do this for any patient who's had even one lymph node removed. I really do feel that it is within our scope of practice that we should refer patients on who have had any lymph nodes removed. I really feel that patients are entitled to be educated on lymphedema risk, lymphedema prevention strategies, and particularly to obtain an LDEX baseline score, which I will refer to in other videos I've already done, but I will put a link to another video I did recently, which is called How Do I Know If I Have Lymphedema? And that video goes into the bioimpedance spectroscopy device that I use in my clinic every single day on the large majority of my patients, certainly any patients that had a lymph node removed, to diagnose, monitor, and manage lymphedema. So when I come back to clinical experience, I've had patients who've had 37 lymph nodes removed. Now, it would be understandable to assume that someone who's had that many nodes removed is guaranteed to get lymphedema. But that particular person I'm talking about has never had a skerrick of lymphedema. So just like we're assuming that patients who've had a sentinel node biopsy won't get lymphedema, we also tend to assume that patients who've had a lot of lymph nodes removed will probably get lymphedema. And clinically, I don't see that either are true. Yes, statistically, if you look at broad numbers of patients who have very few lymph nodes removed, statistically in the research it will suggest they are unlikely to get lymphedema, but the opposite is also holding true statistically for patients who've had a lot of lymph nodes removed. They have a higher chance of getting lymphedema. But as I mentioned at the start of the video, it doesn't always match up that is the case. So the patient who had 37 lymph nodes removed has never had a skerrick of lymphedema, and as I've said before, patients who've had sentinel node biopsies that I've seen in my clinic have ended up with lymphedema. So the take-home message of this video, guys, is that even if you've had a sentinel node biopsy, you are still at risk of lymphedema. So go down to your local lymphedema physiotherapist, occupational therapist, lymphedema nurse, get yourself educated around lymphedema risk factors, how you can prevent lymphedema, and in particular see if you can get an LDEX baseline score on a bioimpedance spectroscopy device. And that is typically an ImpediMed SOZO or an ImpediMed U400, which can give you an LDEX score. Thank you so much for watching this video, everyone. I hope you've gained some great information. If you have any questions on this video, then please leave a comment in the section below. I'll be back here next Tuesday with another video on a topic around breast cancer. Hope you're having a great week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio. I'll see you next time.